May is nationally recognized as Mental Health Awareness Month, and here in the Triad, the inaugural Black Mental Health Summit will be held this Friday. The event is sold out, but we have been speaking with some of the panelists throughout the week here on the Local Vibe.
And joining us now, we have Dr. Allison Harris-Welcher. She is the Senior Director of Technical Assistance at Chiefs for Change. Thank you for being with us.
Great. Thank you for having me.
Well, you're very welcome. We'd like you first to start with the mission of your organization, please.
Yes, absolutely. So Chiefs for Change is a bipartisan network of innovative system leaders that catalyzes reimagining public education to allow all students to access to social and economic mobility with those enabling conditions for success from cradle to career. So we're a network of state superintendents and district superintendents. We actually have members across the nation in over 35 states. And so we're excited to be able to do this work to support schools and students across the nation.
It sounds like really important work, Dr. Welcher, so thank you for touching on that. Why would you say it's important to be focusing on students' social and emotional needs, not just academics?
Yeah, absolutely. You know, when we think about student well-being, in a nutshell, it's about health and happiness. And so in order for students to be able to learn reading, writing, math, they have to feel well. And so students who are experiencing any level of anxiety or depression or greater mental health issues really struggle to even focus and to be present in school. And so it's important that we focus on those mental health needs for students so that they can have the opportunity to access that excellent education that they're receiving.
Okay. Dr. Welcher, can you talk about some of the more prevalent issues that you're seeing among students?
Yes, absolutely, absolutely. So, post-pandemic, while we're a few years out, there are certainly the long shadow effects of the pandemic. And so according to the CDC, a recent survey, 42% of adolescents, feel persistently sad. Additionally, 22% are seriously considering attempting suicide. And so with those great needs, there's a great need for the mental health supports in schools. And some of those big challenges are that there's just not enough staff. There are not enough mental health professionals in schools to provide that support. But additionally, it's also really challenging to understand how community partners can interact with schools and school systems to provide that support.
Wow. So obviously you want to make sure you offer solutions to these students in the school district. So what are some of those potential ones?
Yeah, absolutely. So many schools and school districts, in fact, all of them received ESSER dollars. And so that's code for COVID relief money. And with that money, many of them used it for mental health supports and programs. However, that money is running out this year, September 2024. And so one of the things that can be done is advocating, and what Chiefs for Change is doing is advocating at the federal level for increased funding for mental health supports and for those professionals to get more talent into schools to support students. Now, with that may not be enough. And so what we're thinking about as well is how do we bring those community supports into the school itself? And so thinking about a place-based element where the community surrounds schools and embedding those community-based organizations into the school and providing that mental health support so more students can get access to what they need.
Great. And so you're participating again in the Black Mental Health Summit later on this week. Why would you say that community especially needs this kind of messaging?
Yeah, absolutely. We're just seeing the needs of students just increase greatly, but particularly with Black and Brown students, we have concerns around access and quite honestly, the stigma of mental health in our community. And so ensuring that we're having really open conversations and dialogue around what is mental health, how can we address it, and where the resources are is just so important to get individuals the help that they need, both students, children, and adults.
Thank you for the good work you are doing this morning, Dr. Harris-Welcher, and for your time. We will have this entire segment and all this information posted on triadcw.com later today. And in the meantime, to learn more about the work Chiefs for Change is doing, we invite you to visit their website, chiefsforchange.org.